Hello and namaste everyone. I'm Biju working as a project manager in OXFAM, Nepal. Today I'm going to present about Mom's Magic Hand approach for improved hygiene behavior in Nepal. The project Hygiene Behavior Change Coalition was implemented in Nepal in 10 districts, and these districts were selected based on the increased number of COVID cases and the district which has the cross border. Vulnerable and marginalized community were selected in coordination with the municipality. Basically, the objective of the project were to sustain improved hygiene behavior that limit the spread of COVID-19 and to promote the gender norms with equal distribution of hygiene and health related care works among women and men at the household level and community level. There were many activities conducted during the project intervention. The major project intervention includes raising awareness through risk communication, face-to-face discussion, mass media campaign, and increasing access to waste product. The project has worked closely with the local authorities in order to effectively respond to pandemic and improve hygiene behavior at the household level. The project has adopted the Mom's Magic Hand approach to promote improved hygiene behavior and gender transformation at the household level. MMA champions were selected at the local level in order to raise awareness at the community level. So during face-to-face discussion, Mom's Magic Hand, storyboard, jigsaw puzzle game, scratch card, color powder game, bingo game, like clock game, child as well as the dad magic hands was used as a triggering factors to motivate the people for the hygiene behavior change. During the mass media campaign, the local television, digital display, and the documentary was displayed at the local channel. Different, like the day celebration, was used to raise awareness at the household level. So the local people they have access to waste product like the bucket at the household level with tap and lid. Soap was also distributed. At the institution level, the project has installed the hand washing station with the equal contribution of the local authority. And the project has also used the community perception tracker in order to understand the BCC strategy in shifting people's perception around hygiene and COVID 19 prevention. Uh, the key achievement of the project was that the project has really reached more than 90,000 direct beneficiary, and it has enhanced the knowledge regarding the hand washing behavior and gender care work. It has also like the build the capacity of the local community, like the community group engagement led to inter-household cross learning and communication, thereby reinforcing the key message beyond the MMH session. The survey was carried out during the implementation period, and it has found that 94% of the household have access to hand washing station at the household level, and 98% of respondent uses soap while washing their hands. And the gap between working hours for women has reduced from 11 to 3 hours due to gender care work. That is, the male members have started supporting the female members. So the time was used by the female members in order to improve the hygiene practices. As you can see in the figure, that the male members supporting the female members for the collection of water. This figure basically represents the behavior outcomes of MMH approach, which has contributed to worse behavior change and change in gender norms and practices. While talking about the worst behavior, as I have already mentioned the data, like it has increased the hand washing practices, and the major practice hand hygiene practices was adopted during the COVID-19 for the prevention. For the gender norms, it has reduced the care work, and it has also increased the awareness on gender-based violence and how to report those violence. There were several learnings during the implementation of the project activities. So the mom's magic hand approach was adopted, which was found to be most effective approach in order to change the community behavior, because it has used the emotional motivators and the silent nudges. Since this was the new approach, it was widely accepted by the community members and appreciated by the local community, especially the women and the children, because the IEC materials which was developed was friendly, and the innovative and interesting content and methodology has attracted most of the mothers and the children. That magic hand was also used during the promotional activities, so it has inspired the male member to initiate change from themselves. So they have started like helping the women during the household activities as well. And it has also increased the knowledge of the neighbor community, because we have selected only the limited household which was vulnerable and the marginalized community. So when you talk about one districts, like there were only 100 households, but the knowledge was promoted to more than 500 households. So neighbor have like the copied the good hygiene behavior from the neighboring neighbor, which is one of the good learning. And the integration of gender care work and the was it has a greater impact at the community level. There were several recommendations after the implementation of the project. The major three recommendation was like in order to practice the sustained hygiene behavior, there should be regular supply chain of waste materials at the local level, and we have to build the local entrepreneurs for regular and easy supply of waste materials at the local level. As the project has like implemented the activities at the institutional level and the community level, so the regular operation and maintenance of the hand washing station or the bucket at the household level should be maintained properly. And for this we have to lobby with the local government for allocation of budget during the annual budgeting plan. And the MMH approach, since this is one of the effective tool, it can be used in the total sanitation campaign for the promotion of sustained behavior change at the community level. Thank you. If you have any query, you can come back to me. Thank you very much.